Thank you, Chris, and thank you, members of the media, for joining us this afternoon. As usual, we'll start off with some updates with some numbers. As of this morning, Northern Light Health is caring for 65 individuals as inpatients in our hospitals who are being treated for symptoms of COVID-19. 2 of those are at A.R. Gould Hospital, 42 are at Eastern Maine Medical Center, 4 at Inland Hospital, 3 at Maine Coast Hospital, 4 at Mayo Hospital, 4 at Mercy Hospital, and 6 at Sebasticook Valley Hospital. In addition, our home care and hospice team are taking care of 10 patients in their homes who are symptomatic with COVID-19. Over the last 2 weeks, our COVID-19 positivity rate remains high at 10.49%, with a 1-week positivity rate of 11.1%. As a reminder, that is the total number of positive tests divided by the total number of tests run through Northern Light Health. So what that means is that of every 10 tests that Northern Light Health is running for COVID-19, 1 of those indicates a positive result. You may have noticed that recently we haven't posted the graphic showing how many of our hospitalized patients are vaccinated. We've been working to review the data for better reporting and add the ability to add more detail in the future. Starting today, we will resume showing the graphic on social media every Monday, Wednesday, and Friday. Mayo Hospital is now included in the graphic. The data continues to show that vaccines continue to reduce the likelihood of severe disease. A link to the most recent graphic is in the chat. This data is from yesterday because today's graphic has not yet been updated. As a reminder, these numbers represent a snapshot in time, and ICU capacity in particular can fluctuate very quickly. This data is from 12:01 a.m. yesterday morning. The most important step that Mainers can take to reduce the impact of COVID-19 is to get vaccinated against COVID-19. If you haven't completed the 2-shot series for Pfizer or Moderna or received the Johnson & Johnson vaccine, now is a great time to do so. The COVID-19 vaccines currently in use continue to provide strong protection against COVID-19 infection, even for those who received the vaccine months ago. That said, booster shots may offer additional protection to some groups of people. Booster shots are currently available for Pfizer vaccine recipients who meet certain criteria. Those who qualify include older Mainers, people with certain underlying medical conditions, and people who are at increased risk of exposure. Boosters are currently not indicated or available for those who received the Moderna or Johnson & Johnson vaccine. If you think that you may qualify, please visit our website for more information. Northern Light Health is prepared to provide booster shots as quickly and conveniently as possible to those who qualify. We are pleased to announce that appointments are now available on northernlighthealth.org/COVID or by calling 207-204-8551. Our website has a list of locations as well as more specific information about who qualifies. An appointment is required. We will not have walk-in access for these booster shots. If you think that a booster shot may be right for you and you have questions, your primary care provider will be a great resource. Our website also contains a lot of great information. It is also time for influenza vaccines. If you are receiving a booster or your primary series for the COVID vaccine, you can get your flu shot at the same time. We are again urging people to be vaccinated against the flu as well as COVID, as influenza can also be a costly and deadly disease. And with that, I'll turn it over to Paul to talk a little bit about employee vaccination.
Thanks, Dr. Jarvis. And so just as an update on where we are in terms of our workforce vaccination efforts, we have reached 92.9% vaccinated among our workforce across Northern Light Health. That number is effective Monday morning, and so we know that we are making continued progress toward that. So we look for that number to increase when we do our tally at the end of this week as well. In addition, we're working with staff who continue to have questions or hesitancy regarding vaccine, and we know that our availability of Johnson & Johnson dosage for our employees is available throughout the state for our employees to receive and still comply with the October 29th fully vaccinated deadline as directed by the state of Maine. And so we have time to do that, a little more than 2 weeks, and we continue to work with our staff regarding any questions of hesitancy at all so that we can get those folks vaccinated and continue with us beyond the deadline imposed by the state. Dr. Jarvis?
Thank you, Paul. We'll turn it back to Chris to start our question period.
Okay, thank you very much, Paul, Dr. Jarvis. We're going to get to our media questions. And first up is David Horowitz from WVII. David, you should have the ability to unmute and ask your question.
Okay, can you hear me?
We can, David.
Yes.
Okay, cool. I just have one question for Dr. Jarvis, and I know you say that you don't have a crystal ball, but remember last year at this time you said you thought we'd have a surge at this time the following year. So I guess what trends are you seeing with the pandemic? Because some people are saying they feel like the pandemic is over, but it's obviously not. So what trends are you seeing?
Yes, that's an excellent question, and thank you for bringing up that I was off by about 3 months with my crystal ball. Unfortunately, with the Delta variant, we saw that huge surge that happened at the end of the summer that continues now through today here in the state of Maine, and that just kind of speaks for how much more transmissible the Delta variant was. That it actually kind of came out of nowhere for us here in the United States, and then really overwhelmed many of our hospital systems. Crystal ball, right now it looks like the state of Maine is kind of at a plateau, but at a plateau at one of the highest kinds of numbers that we've seen during this entire pandemic, including last winter when we were talking about, we were hopeful that was going to be the worst that we saw. I do hope that, as we've seen in some other parts of the country, that numbers will start to decrease over the next few weeks. That is a hope, and that is not a forecast. And so, again, the best thing people can do is to protect themselves. If you are not yet vaccinated, please, and you are eligible, please go ahead and get vaccinated. Please wear your mask while you are indoors. Stay appropriately socially distanced and wash your hands frequently. And of course, if you're not feeling well, stay home and reach out to a provider if needed.
David, thank you for your question. A point I should have brought up, but I'll remind you all again, members of the media, is let us know at the start who you'd like to direct your question to. Obviously, if it's anything medical or response related, that would be Dr. Jarvis, and certainly Paul can speak to any sort of human resource employee type question, but that'll give our camera operator time to get the camera moved. So just let us know who you'd like to direct the question to, if you know at the start of the question. And next up, we're going to go to Joe Lawler with the Portland Press Herald.
Yes, hi, good afternoon. Just following up on the workforce vaccination, has there been a number of people who have already resigned and indicated in their resignation that the vaccine mandate was a reason or one of the reasons why they resigned?
Sure. We've had 89 people leave since the state mandated vaccination, and that includes vaccination for flu shots as well as COVID. Early on, when the state, on August 12th, when the state provided its guidance to healthcare employers across the state, a few employees indicated that they wouldn't be receiving the flu shot, and others have also indicated such on the COVID. But we know that those numbers, although 89 is certainly an important number in terms of our workforce, it's relatively small compared to what we've seen in staff outages for those who've been unvaccinated and exposed and out of work as well. So we still see vaccination as critical to our workforce continuity and our ability to provide care to our patients.
Okay. And I know some other healthcare systems across the country who've already, fully implemented their vaccine mandates are seeing upwards of 99% or more of their workforce fully vaccinated for COVID. I know you said 92.9% right now, and there's still a little bit of time. Do you think that's roughly where you're going to land at about 99%, or do you have any sense of that?
I don't know for sure. I know that we'll be fully compliant with the state's mandate. So of our workforce on 10/29, it'll be everyone will be fully compliant on or after that date. What we hope to do is ensure that people who have questions about vaccines still over these next 2.5 weeks, where there's still time for them to receive the Johnson & Johnson vaccine and still be fully compliant with the state's mandate. Those are the folks we're focusing on right now to ensure that we're answering their questions with fact and detail as compared to some of the social media and other misinformation that might be available that still seems to provide some confusion to folks.
Okay, thank you for your questions, Joe. Next up, we have Chris Costa from News Center, Maine.
Hi there. My first question is for Dr. Jarvis. and it's relating to testing. And Dr. Jarvis and the rest of the Northern Lights staff, I apologize if I missed this email, but I just wanted to ask a quick question. We have heard kind of in about maybe 2 weeks ago now, there were some issues with testing supplies, maybe the state not having enough, or basically there was a big demand for testing supplies. So my question is twofold. One, do we have a sufficient amount of supplies? And two, is Northern Light Health going to be reopening the swab and send sites that it had previously?
So I'll answer those in twofold. So first, as far as supplies go, that has not been an issue for Northern Light Health. Our lab has been able to maintain an adequate supply to continue to meet the demands, especially the clinical demands of the communities that we serve. Our challenge actually is just the runtime in the machines and how many tests we can run at a single moment. We are running upwards of 1,400 tests a day for COVID-19 every single day. That's almost a new record for us. So the volume is what our issue is, and it's because of the volume that some people have seen delays, particularly if they're getting a test for non-clinical reasons such as for travel. As far as opening up our swab and go sites, we have done that in several of our communities. And so we have reopened our one here in Bangor out by the airport, as well as our one at Mercy Hospital. And we have continued to provide testing at all of our facilities across the state, as well as our retail pharmacies. So we have tried to make as much access as we can. Unfortunately, due to the rapid spread of COVID-19 and the Delta variant, our demand is very, very high and continues to be high. And like I said, 1 out of 10 of those tests run now are positive.
I see. Thank you. And then my second question has to do with the kind of preliminary step that we are still at with Pfizer submitting its data to the FDA for its vaccine for kids ages 5 to 11. So I understand that there are still several steps in the process before we would actually start rolling out shots to kids. Where do things stand from Northern Light Health's perspective? How does this work once it potentially gets some type of recommendation from the CDC?
So of course we'd have to review those recommendations as we do with any medication or biologic agent that we use as far as treatment goes. So we would review those. We are prepared to do those at any time that information is released to us. Behind the scenes, we continue to prepare not only for vaccination for people who meet requirements for an additional dose, such as those who are immunocompromised, or for booster shots for people who received the Pfizer vaccine more than 6 months ago. But we also are preparing for when we're able to give a primary series to those who are under the age of 12. And so we continue to look at that and prepare for it. We continue to work with the state as well as other partners around the state and other health systems around the state in order to make sure that we will be able to meet any demand that happens at that particular time. And that could include things like doing vaccinations at schools, setting up pop-up clinics. And of course, our primary care offices and our pediatric offices are already providing vaccine for people who are age 12 and older, and therefore we would just be able to continue that for those who are under that age group.
Okay, thank you very much for your questions, Chris. We're going to move on now to Brian Sullivan from WABI.
My first question is for Paul, so I'll let you swing it over there.
Sure. Hey, Brian.
Paul, what is the anticipation, or do you think there'll be a need for staffing other than Northern Light Health nurses or healthcare workers after 1029, and where, if necessary, might that come from?
So we've had, to the extent that we've got folks unvaccinated and not able to work after 1029, our nurses at this point are about 93% vaccinated, our physicians about 97% vaccinated, and others in clinical roles have a very high level of vaccination. We expect those numbers to continue to increase closer to the 100 mark, which is, of course, the goal over the next few weeks. But we also know that nationally there is a shortage of traveling nurses and locum or traveling physicians, which means that our ability to offset or supplement our workforce with other clinically trained folks from other organizations will be very limited. So our focus really is internal to make sure that we retain the people that we have, respond to their questions and concerns should they have any at this late stage, and also focus on our non-clinical support staff. We do have opportunities for volunteers to do health screening and other activities similar to what we saw at the mass vaccination locations to help supplement. And we have administrative employees from our home office and other parts of our system throughout the state supporting our hospitals, performing those tasks as well. And we're all pitching in together to focus on the task at hand of caring for our patients.
And okay, so this one can be for either. Thank you, Paul. Maybe for
Sure.
Dr. Jarvis for you. So it looks like the numbers from last we spoke are down a little bit, and you mentioned a plateau. Where do you see? What are you seeing nationally? You know, it seems that maybe Maine has trended about 2 weeks behind the rest of the nation. What are you seeing and anticipating, especially as you do have a deadline of perhaps losing some staff in about a month here?
So of course our mission remains the same, to serve the communities that we currently are in and provide the full spectrum of care that we can across those communities. And we will continue to strive to do that regardless of the pandemic, shortage, or whatever. We owe it to our communities to care for our communities as best that we can. Unfortunately, that due to the volume of individuals who are positive for COVID-19, who are taking beds that typically would not be filled, that becomes a challenge for us, and we will continue to work through those challenges. As far as expectations go, I'm hopeful that we are just following 2 weeks behind some of those states that have seen a decrease. But even in those states that they've seen a decrease in number of cases, the caseload is still much higher than we saw through most of this pandemic. And so we expect that we will continue to have hospitalizations and, unfortunately, deaths. You did mention that our hospitalization numbers are a little bit lower than what I reported last week, and that's true. Unfortunately, some of that is due to the fact that we have had people who have died at a more frequent rate over the last week than we've seen before, and that's a tragedy. We also know that many of those individuals who we reported on before have recovered but are not yet ready to return home, and therefore are still in our hospitals because of the critical shortage of bed space in our long-term care and skilled facilities. And so it's really a twofold thing that's kind of causing the issue around capacity around the state. It's one, seeing more people who are sick and needing to have that care, and unfortunately, once they've recovered, not having a place to go to immediately after their need for hospitalization ends. And it's a twofold problem, and it's one that we continue to work on as a state, but one that you can all help us with by trying to remain as healthy as possible. And when it comes to COVID-19, that again is vaccination, washing your hands, appropriately socially distanced, staying home when you're sick, and wearing a mask when you're indoors.
Thank you for your questions, Brian. Next up from WMTW, we've got Suze Giggy.
Hi, I think this is a question for Dr. Jarvis, but we're wondering if you guys are anticipating any interruption in funding for testing, supplies, and treatments given the possibility of a government shutdown.
Yeah, so that's really not up to us. As Northern Light Health, we will continue to provide services as we always have. The funding sources that come directly from the federal government, I would reach out to the states to see what the state's plans are. Again, for things like testing supplies, in some instances we receive those from the state. We also partner with the state to run some of our tests. And similarly, vaccines and other agents that we use to treat COVID-19 come to us through the state. So I would have you reach out to the Maine CDC for information on that.
All right, thank you. Thank you. That's all I had.
Okay, thank you, Suze. Okay, we'll move on next. I believe it's David from Bangor Daily News. As soon as you're unmuted, David, feel free to ask your questions.
Thank you. These are both for Dr. Jarvis. Are you currently allowing testing for traveling to Canada at any of Northern Lights locations? If not, are there any expectations that it could be allowed in the future? And where would you recommend people get tested for such travel right now if it's not available at Northern Light hospitals?
So it is possible for people to get tested for travel at our facilities. Unfortunately, due to the high volume that we have for a clinical need, the turnaround time often does not meet the requirements for travel. At Northern Light pharmacies, you may be able to obtain a test for travel in a more timely fashion. It does have a cost to it, and we know that there are other retail pharmacies and other agencies that for a fee are providing services where they can do a more rapid turnaround time. Really, it behooves everybody to call ahead and ask what's available to them and ensure that they're getting the kind of test that they need to travel to whatever particular country they're traveling to.
And my second question is, I'm just looking at this graphic, and it appears that an increasing number of vaccinated patients are being hospitalized. In the ICU, it's 4 out of 13 now, and I remember when you first shared that graphic, it was 0. Is this the Delta variant? What is that something that you've noticed, that more people are vaccinated, people are getting hospitalized in your hospitals?
So yes, we have seen an increase in people who are fully vaccinated who are now requiring hospital services, but I will point out that the overwhelming majority of individuals who are sick with COVID requiring hospitalization are still unvaccinated, and even more so when we look at those that are in the intensive care unit or those who require ventilator support. I'll also remind people that more Mainers are vaccinated against COVID-19 than those who are unvaccinated. So it's really even more of a disproportionate for those individuals who are unvaccinated who are winding up in our hospitals. Vaccine is still clearly our best way out of this pandemic.
Thank you very much for your questions, David. Sorry, I was working on the chat window, but I realize I missed Mal Meyer from WGME. So Mal, you're up next. Go ahead and ask your questions.
Yeah, so my question is about boosters, and sorry, I've been away for a week, so sorry if you answered this last week. There's just been a lot of back and forth on booster shots, what's going to be recommended. At first it sounded like maybe everybody would need it after, a few months and things like that. Should people be concerned that theirs are wearing off, but they don't meet the criteria now for another dose?
No, they should not be, and that's a great question. So right now, we know that all 3 of the vaccines currently authorized in the United States continue to provide very good protection against severe disease, hospitalization, and death. And again, those were the endpoints we were looking for. So we know that even if you were one of the first people to receive your vaccine over 8 months ago. So everybody who's been fully vaccinated still has very good protection against COVID-19. We also know they still have protection against even mild to moderate disease or spreading the disease from one person to another. Right now, the prediction is that maybe we're talking about, for the Pfizer vaccine, somewhere between 65 and 85% prevention of those endpoints, which a year ago, had we been told that we had a vaccine that would give us that high of protection, we would have been ecstatic. We were so fortunate that these vaccines have provided protection up as high as 94, 95% against severe disease, hospitalization, and death. And so while the immunity might have waned for the general public, it is still much higher than we would have predicted for a vaccine in general. So that's the good news. As far as those who are eligible for the vaccine, remember, it is only for the Pfizer vaccine at this point because they're the only ones that submitted their data to have it completely reviewed by the FDA and the CDC. It is for all individuals who are over the age of 65, and then those individuals who are under the age of 65 who have certain underlying medical conditions, or they work in an occupation where their exposure risk is much higher than the general population. So that would be healthcare, teachers, grocery workers, food service workers, certain first responders, and a few others. And so all of that information can be found, including which high-risk conditions put you at higher risk for contracting COVID-19, all on the CDC website. There are links to that on our webpage.
And then my next question is, I know that early on we had talked a few weeks ago actually about the boosters, and there was early on there was guidance that in extenuating circumstances that people could use, if you got Moderna at first, you could go over to the Pfizer. If you got Pfizer, you could go over to Moderna. And that was for people with certain medical conditions to get a booster. So why wouldn't that necessarily be the case for the rest of the population who also fit the other criteria, maybe not medically compromised, but might be elderly?
Yeah, that's a great question, and really has to come down to having data available to support doing such things. There has been a little bit of controversy and discussion and disagreement between agencies that review the data, both for just the booster shots for the Pfizer vaccine in general, and then whether or not we can do what we call mix and match, meaning that you got a Moderna vaccine and now you get a Pfizer vaccine or something similar to that. So right now we're just waiting on the FDA and the CDC's advisory committees to review that data. We have been told that they will give us some advice on whether mix or match is an appropriate thing to do, but at this time we know they are reviewing whether or not to recommend booster shots for those who initially received the Moderna vaccine. So hopefully we will hear about that in the coming weeks, and then shortly after that, a Johnson & Johnson. It is just a matter of having data and then reviewing data and then making recommendations based on that data. And it just hasn't happened yet beyond what we've talked about for the Pfizer vaccine.
Thank you very much for your questions. We're going to now move on to Patty White from Maine Public.
Thanks. My question is for Dr. Jarvis. Following up on boosters, can you just tell us, do you know how many booster shots you've administered and what's the demand like? And is there a certain type of person who's eligible? Are you seeing more demand from certain groups?
Yeah, it's a great question, but we don't have that information as of yet. It was only early this week that we were able to even start to schedule people for booster shots, and that really had to do with the fact that we had to wait to hear more information from particularly the CDC on what their guidance was going to be, and then coordinate with the state. We receive our vaccination through the state program, and therefore needed to coordinate with the state and other health systems in terms of making sure that we were following the guidance that was given to us from the federal government. And so that's really where our delay was, and it's the reason why we really don't have numbers of that. We have administered booster shots to those who qualify, and of course we have been giving that third shot for those people who are immunocompromised. We've been doing that for several weeks now, and so yes, we are doing that, but I don't have any more specific data.
Okay, thanks. My next question is for Paul. Paul, I'm wondering, I know everyone who is hesitant about vaccines has individual reasons, but at this point, is there kind of a common reason why people are still hesitant?
So a lot of what we're seeing, and again, this is all anecdote, because as you said, everyone does have their own individual reasons for that population, the 7% or so of our employees who are still yet to be vaccinated. There's still a lot of misinformation out there. And so we're trying to make sure that we're not relying on email or in person, or we have multiple ways of communicating to employees and making our experts like Dr. Jarvis and others throughout our system available to answer questions. Because the common theme that I generally hear from staff who have questions is either a very small subset who says, I'm not getting vaccinated and for philosophical or political reasons, but the most of the folks that have not been vaccinated have expressed some questions that we need to dispel some rumors and misinformation that continues to be out there through social media and other other forums. And so that continues to be our effort. The education, provide fact and data and information with local experts that people know. Their own providers and our other experts throughout the system is the best defense, and sometimes it's multiple conversations to ensure that people get all the information that they need.
Okay, thank you very much for those questions, Patty. We have Melissa from WVII ABC 7, but her mic's not working, so she texted or typed in a question that I'll read. This is going to be for you, Dr. Jarvis. And the question is, how important is it to get the flu shot this time of year with COVID-19 being an issue?
Yeah, that's a great question. We had a very, very mild flu season here in Maine last year, and we attribute that mostly because of all the great protective things that people were doing to prevent them from getting COVID-19. Unfortunately, as we've seen, we have dropped our guard and seen COVID-19 cases rise dramatically in the last few months. And so that's the fear going into a new flu season, is that the safeguards that we put in place to mitigate COVID-19 and had decreased the amount of influenza we had seen. If people aren't following those now, we will see influenza happen just as much as we'll see COVID-19. The problem with that is that, one, the symptoms of influenza mirror the symptoms of COVID-19. So that means all of those people with influenza, we have to initially treat as if they have COVID until we get a negative test result on them. And then, of course, we know that every single year, 100 or more Mainers die from influenza. That's another burden that puts us on our healthcare system and on the families of those people who die. And so it is important that you get vaccinated against both COVID-19 and influenza. One, to protect yourself, your family, your loved ones in your community, and two, to protect the very precious resources that we have through our healthcare system in order for us to take care of those individuals who need us for other things, the things that happen every single day, the car accident, the heart attack, the woman who needs to deliver in a safe place, children who are ill. We need to be open to be able to continue to do that, as well as provide chronic care disease, preventative medicine, routine surgeries, elective procedures, all and the like. We need to continue to do those things. The best way you can help us to do that is to stay well by getting vaccinated.
Okay, thank you very much for that question, Melissa. One last question I'm going to get in. This one will be for Paul. And I think looks like it's going to be a follow-up to one that actually Patty had asked you about what you're hearing from employees. And the question is there a most common piece of misinformation that you hear from employees about vaccination?
The most common piece of misinformation that I'm hearing, and again, there are myriad different bits of misinformation, is the experimental nature of the vaccine, or religious objections due to fetal cells, or polyethylene glycol allergies, all of which have very reasonable alternatives. Since we have 3 vaccines available, there really is a bit of misinformation that some people still have. And again, it's not the majority of folks, but it's that small subset of to-be vaccinated employees that we have. And so we try to meet people where they are in terms of address those concerns, refer them to some of the materials that we've been providing for months now, but also taking very seriously their concerns, because they're very sincere and heartfelt concerns, and we're trying to address those in a respectful manner to provide that guidance for them.
Okay. Thank you very much, Paul. Dr. Jarvis, for being here today. Thank you to members of the media as well for your interest. And I guess we'll let that be the last word, and we'll wrap things up. Have a great day, everyone.
Thank you, everyone.